Hi there, thanks for tuning in. Today we are using our VSoft Lift PDO smooth threads in the treatment of a brow lift and also submental area for tightening of the submental tissue. So we are using a 29 gauge by 30 millimeter mono smooth thread here, and you can see I'm laying them like planks above the eyebrow, and the purpose of this treatment is to get a little bit of a brow lift. So the way that PDO smooth threads work is by stimulating neocollagenesis, which is the production of collagen and elastin, which will help tighten and hopefully lift this patient's brow. This tends to be a less invasive option as opposed to PDO lifting threads for a brow lift, and therefore this patient had decided to proceed with a little bit of less invasive treatment. And so we will treat the brow area every 4 weeks for the next 3 months before reevaluating to see her progress. The peak collagenesis timeframe, neocollagenesis timeframe, is from 3 to 6 months. And so we'll treat her every month for the next 3 months and then give her a break from there and sort of see the results at that point. And hopefully we will have achieved the lift that she is interested in. But if we haven't, you can certainly restart treatment at that time, either by treating another 3 treatments, or maybe you want to add just 1 or 2 treatments. But this is a great option for very gradual improvement of the positioning of the brow. As you know, collagen takes time to form, and so therefore it's not going to be a dramatic improvement, but more so very gradual results over time. So be sure that you're taking excellent photos to document progress, because sometimes when we experience this subtle improvement or subtle changes, especially for the patients who are looking at their faces every day, they might not appreciate the improvement that they're seeing because they look at themselves every day. But a lot of times then when you take your before and after photos and show them, they will really be able to see that, wow, there is much improvement in terms of the height of my brows. And of course, we are hoping for those kind of results for this patient. So you can see she's tolerating the procedure really nicely here. She was numbed with a topical anesthesia. And the threads generally, when put in the right plane, go in very smoothly. We teach PDO smooth thread courses at the AAFE. And if you take a training with us, I'm certain that adding this treatment to your practice will be incredibly beneficial for not only the results that you're able to deliver to your patients, but in terms of the financial benefits as well. These threads can be fairly lucrative, and they are quite easy to place. We are going to move to the submental area. So you can see that I've marked her in a bit of a sunset pattern. We are going to stimulate collagen about 1.5 millimeters from where your thread is actually placed. And so I like to have them placed pretty closely together to ensure that we get that nice neocollagenesis in the submental area. And the goal for this area is to tighten the tissue and contribute to a little bit more of a sharp jawline. And so I'm using a 29 gauge by 40 millimeter twisted thread. And the reason that I'm using twisted here is because I'm looking for dramatic results. Your twisted threads are going to be the thread that stimulates the most collagen, given a little bit more of tissue injury upon entry. And so it's going to stimulate our inflammatory response, which will in turn help stimulate collagen. And so I'm really, ensuring to treat this area completely with our threads, and I've chosen to use that twisted thread for that reason. I'm really hoping to give her some dramatic results. They are a little bit more difficult to place, as you can see, and they also are a little bit more uncomfortable for the patient. So oftentimes people ask us, why don't we use twisted threads on every patient if they give maximum results? Well, some patients don't need maximum results. Maybe they just need a little bit of an enhancement, but also, again, they're a little bit more uncomfortable to place. So perhaps for your patients who are a little more squeamish or don't tolerate pain well, perhaps you might be best to start with a mono thread for them and see how they do. And then you can choose to go up to a twisted thread if you feel like the results they're getting from the mono threads are not delivering what you're hoping to get. Thanks so much for watching. We hope to see you in a PDO Smooth Threads course soon.